Hello, my name is Shelby Plowman, and I'm going to be talking about insulin administration. Diabetes is a chronic multi-system disease related to abnormal insulin production, impaired insulin utilization, or both. The long-term complications of diabetes make it a devastating disease. Diabetes is the leading cause of adult blindness, end-stage kidney disease, non-traumatic lower limb amputations, and is a major contributing factor in heart disease and stroke. People with diabetes are also more likely to have hypertension. The goals of diabetes are to reduce symptoms, promote well-being, prevent high blood sugar, and prevent or delay the onset and progression of complications. The goals are most likely to be met when the patient can maintain blood glucose levels as near as normal as possible. Patient teaching enables the patient to become the most active participant in his or her own care, which is essential to achieve blood sugar goals. Insulin decreases blood sugar when it gets too high. Your doctor will tell you how often to check it, but it's usually before meals and before bed. Then you'll treat according to your blood sugar and the sliding scale your healthcare provider will give you. There are many different types of insulin. You have rapid acting, short acting, intermediate acting, and long acting, and sometimes they're combined. Rapid acting happens fast, it lowers your blood sugar quickly, and long acting lowers your blood sugar all throughout the day. Whenever you receive your insulin from your doctor, you need to know how to store it. Heat and freezing alter the way insulin works. Insulin vials and pens currently in use may be left at room temperature for up to a month. Prolonged exposure to direct sunlight should be avoided. A patient who is traveling in hot climates may store insulin in a thermos or a cooler to keep it cool. Unopened insulin vials and insulin pens should be stored in the refrigerator. Pre-filled syringes should be stored in a vertical position with the needle pointed up. Insulin syringes come in many different lengths: 1/4 inch, 5/16 inch, and 1/2 inch. Needle gauges also vary. The gauges are available from 28 to 31, and the higher the gauge number, the smaller the diameter. An insulin pen is a compact portable device loaded with an insulin cartridge that serves the same function as a needle. They have a greater convenience and flexibility. They are portable and compact and more discreet than using a vial and a syringe, and provide consistent and accurate dosing. After you use your needle, you need to throw it away into a milk jug, laundry detergent container, or a 2-liter bottle to protect others from needle stick injury. Mixing insulin is sometimes required. You may need to mix a short and long-acting insulin for better blood sugar control, but the only insulin that cannot be mixed is insulin glargine. To mix insulin, you need to wash your hands. You need to rotate the long-acting insulin or the cloudy in your hand. Never shake it, only roll it between your hands. Wipe off the top of the insulin vials with an alcohol sponge. Draw back the amount of air equal to the unit that you're going to be injecting. Always go from clear to cloudy. Pull up your clear first and then pull up your cloudy. And I'll have one of you demonstrate that later. There are different administration sites. The 4 main ones are your abdomen, the back of your upper arm, your buttocks, and your upper thighs. These places have a lot of sub-Q fat, so it's easier to go in and less painful for the patient. Whenever you go to inject, do not inject into a place that you're about to exercise. So if you're about to go running, don't inject it into your thigh, because that you'll increase your body heat and increase your circulation, and your insulin will be absorbed too fast and your blood sugar will drop. Teach the patient to rotate injection sites at least weekly. So if you use your abdomen for a week, the next week you need to go to your thigh, and so on. This decreases the amount of tissue damage and allows for better absorption. You need to make sure you keep a daily logbook for insulin injections, including results of your glucose test, the type and amount of insulin given, their expiration dates, and what time and injection site you use. Okay, so when you go to inject your insulin, you need to wash your hands. Always inspect your insulin bottle. Make sure that it's not got stuff all in it, that it's not expired, and that the top of the bottle isn't broken off. The insulin should look clear and colorless, except for your long-acting, it's cloudy. If it is cloudy, gently roll it to see if you can get it to mix up. Select your site. You either need to cleanse it with soap and water or an alcohol pad. Pinch up your skin and stick the needle directly into your skin and leave it in for 5 seconds after you inject it. That makes sure that all the insulin gets injected and that it's absorbed, and then throw it away in the correct spot. Now we're going to watch a video on how to inject it.
When giving an injection of insulin to yourself or to a family member, follow all of the instructions given by your healthcare provider. Here's a demonstration of the steps to take. Wash your hands thoroughly with soap and water. Dry your hands with a clean towel or paper towel. Place a syringe and other materials on a clean paper towel. Then choose the injection site. Choose a smooth area of skin away from recent injection sites, moles, scars, rashes, or within 2 inches of the navel or belly button. Clean the injection site with an alcohol wipe. Open a new bottle of insulin, take off the cap, leave the rubber stopper in place. Wipe the top of the bottle with a clean alcohol swab. Take the cap off the syringe and pull the plunger to fill the syringe with air equal to the amount of insulin you will be giving yourself. Put the needle straight through the rubber stopper, push the air out of the plunger, keep the syringe in the bottle and turn both upside down. Make sure the insulin covers the tip of the needle. Pull the plunger back until you have the proper dosage of your prescription. Make sure to tap out any bubbles. Push the air bubbles out with the plunger, then refill the syringe with the proper dosage of insulin. Pull the needle out of the bottle and don't let it touch anything. Lightly pinch the injection site and hold firmly. Insert the needle straight into the skin the way you were shown. Let go of the skin. Push the syringe plunger all the way in with a slow, steady motion. Inject the full dose of insulin. Wait 10 seconds. Remove the needle by pulling it straight out of the flesh. Gently press the injection site with a clean gauze swab or cotton ball. Then properly dispose of the syringe in a Sharps container. If you don't have a Sharps container, put the needle in an opaque plastic bottle and close it with a cap before throwing it away. Be sure to keep all syringes and medications out of reach of children. If you have any questions, contact your diabetes educator or your healthcare provider.
So that was how you inject insulin, and now I'm going to get a volunteer to come up and show me how to draw up 2 different types of insulin and where she'll inject it. So Maddie.
First I wash my hands.
Yes. And then you're going to shake up your cloudy. Roll it between your hands, and if we had an alcohol pad, we would wipe it on the top of both of them. So we're going to take our syringe and we're going to draw back however much cloudy insulin we're given. So we're given 30 units of cloudy insulin. Inject it into your cloudy. Okay, now pull it out.
Whole needle.
Pull back 30 again and inject it into your clear, but you don't pull the needle out this time. This time you're going to draw up 30 units of insulin. Make sure you don't get any air in it. If you need to pull back farther than 30 and get rid of your air bubbles, you can. Okay, now we're going to draw back 30 of our cloudy, but make sure not to push any of the regular insulin into it. Okay, so that's how you mix up long and short acting insulins. So we're going to put the top back on it for safety issues. Now, if we were going to inject that insulin, what spot would you give it in?
The abdomen,
Or,
the butt, or the thigh.
okay, and whenever you,
do a pinch your skin up.
yes, and how long do you leave it in?
5 seconds after you inject it.
Correct. Thank you, Maddie, for explaining that to us. You may go sit down. All right. Now, I'm going to ask you a couple questions. Ready? What are the 4 spots that you can inject your insulin into?
The abdomen, the thigh,
buttocks.
the buttocks,
That's correct.
and the back of the arm. And the back of
Yes.
the arm.
Thank you.
Back
And you
arm.
always want to get it into your sub-Q or your fat. You never want to go into the muscle. That's why we pinch up on our skin. Okay? And big thing, always draw up your clear before your cloudy. Clear before cloudy, always. All right, thank you for being at my demonstration today.